I'm going to share real quick. Okay, so I am wanting to have an open discussion about complicated grief. I don't go live on here very often, so I don't expect a lot of people to show up. But the one thing I really like about YouTube is that the lives stay on. I'm going to turn this TV off real quick. Hold on. Okay, so I've been going through complicated grief for I don't know how long. I've been going through grief for over 18 years, and I found out that I've been going through complicated grief this time around. Um, and I've watched a lot of things on complicated grief, and the main one that I watched that really opened my eyes was Andrew Huberman. He's on here. He's an amazing neuroscientist, and he talked about grief versus complicated grief. And it was when I realized that I was in complicated grief, and it frightened me. When you read about it, it is if you're still grieving after a year and you can't move on or even not focus on the loss, you're in complicated grief, and that oftentimes comes with hospitalization. um, and in my mind, losing two children before my third, who wouldn't be, you know um, I'm going to keep trying to invite people. Yeah, the reason I'm doing it on here is because my TikTok one is really messing up and it's not letting anyone discuss, like, comment. So complicated grief is, so here's an example of something that happened. My daughter passed away January 18th, 2023. And I was talking to my partner a few weeks ago and talking about coming up on her 1 year anniversary. And it just about brought me to my knees because I feel like it just happened. And I felt like that this entire year. And then I got panicked, like I lost a year, but I didn't. I know what's going on. Like, I'm not completely gone, but to think that it just happened every day is really taxing. It's really difficult. And it's kind of scary, I know my daughter, my 7-year-old, she started her first year of second grade this year, and in a new school there's a lot of things that have gone on this year that I'm very well aware of. So I don't want you to think that I don't know what's going on, but I'm trying to get this so I can read some things to you guys. um I need this to end. I need it to end. I miss my daughter, and I will for the rest of my life. And just because I have CPTSD, after losing my first two, I always thought, well, I'm sure I'll lose another. And then I did. And I wondered what that would do to me. And now I know. I've been in the darkest place that I've ever been in my entire life, and I've said that a lot, but this is the darkest place. It's hard because I'm conscious and aware that I'm lost. And when you're lost and you're not conscious of it, it's a little bit easier. But when you're not where you need to be and you can't quite figure out how to pull yourself out, it's quite scary. And so I'm looking for people who can help and comment and even, join me on here to talk about it. So I'm going to read to you the difference between grief and complicated grief. And then there's also dysfunctional grief, which I just found out about today. So complicated grief, and this is from mayoclinic.org. So basically, complicated grief. Most people experiencing normal grief and bereavement have a period of sorrow, numbness, and even guilt and anger. And gradually, these feelings ease, and it's possible to accept that loss and to move forward. For some people, feelings of loss are debilitating. So, debilitating is like the perfect word. It's been debilitating for 11 months for me. And it doesn't improve even after time passes. This is known as complicated grief, sometimes called persistent complex bereavement disorder, which I hadn't seen that before. In complicated grief, painful emotions are so long lasting and severe that you have trouble recovering from the loss and resuming your own life. And you can see that even on like my TikTok, which I've been doing for 3 years. I had a really good following, a really good group, and I fell off the face of the earth because I would get on here and say, okay, I'm going to go live. And then I'd be paralyzed, or debilitated, and I wouldn't do it. And so I've lost viewers from this as well. Having trouble resuming your own life. So I haven't painted in so long. I am working on my book. I'm finishing that because that's something that I promised my daughters, and I'm going to stick with that one. But I will tell you it's hard because I'm writing about their deaths. Different people follow different paths through the grieving experience. The order and timing of these phases may vary from person to person. Accepting the reality of your loss, and I know that I haven't at all. Allowing yourself to experience the pain of your loss. I feel like I live that every day. Adjusting to a new reality in which the deceased is no longer present. And that like makes me, that's hard. I was talking to my partner last night or the night before, a couple nights ago. And it's like I think I said something like, I wonder who I'm going to end up being. Who is the new Missy going to be? Because it's certainly not going to be who I used to be, which was just fight or flight. Because when I lost my first two, I went to drugs and I did a long 5-year run and ended up in jail and all the things, got clean, and then I got pregnant. And so I never grieved properly. I went straight into a higher level of fight or flight, trying to survive my now 7-year-old on my own when she was an infant. In my mind, I had 2 children that had already died, so she was going to too. So I was constantly checking her temperature. I was constantly doing all these things that were driving her crazy and caused her panic disorder. And then I came out of that, and it seemed like things were really good for quite a while. And then my daughter died. My oldest, my firstborn daughter died. And that compounded with never properly going through any of the steps grieving my other children. I wasn't even allowed to grieve my first one so much, and I was so gaslighted around it that it wasn't even a thought a lot of the time. It's in my book, but it wouldn't be like on my mind. And Poppy would be front and center, and now Colette is front and center. And I have delved into so many things to try to figure this out. So obviously today I'm having an okay day. I was up, I showered, I dressed, all the things, but I never know if tomorrow is going to be the same. And it says, so, okay, so different people follow different paths through the grieving experience. The order and timing of these phases may vary from person to person. Accepting the reality of your loss, allowing yourself to experience the pain of your loss, adjusting to a new reality in which the deceased is no longer present, and having other relationships. So, I've experienced trouble in my relationship because of this, not because of partner or anything, but me just feeling like I can't get through this and I'm just someone's life by crying every night and needing, needing to understand, but not being able to. These differences are normal, but if you are unable to move through these stages more than a year after the death of a loved one, you may have complicated grief. If so, seek treatment. It can help you come to terms with your loss and reclaim a sense of acceptance and peace. So I've done that. I've done therapy. Um, Clearly, it wasn't the right one. It wasn't what I've tried a couple different ones, and it wasn't a fit. It was like teaching me how to do deep breathing and things that I teach other people. It wasn't getting down and dirty into my mind. And someone has suggested to do the erratic eye movement. And I'm so scared to do that because I know that there are so many repressed memories in there from my abuse and from who knows what. But, if anybody's done that, I would love to hear about it. I have a couple of friends who have done it and absolutely swear by it. Um, it does bring up memories that are suppressed. And like I said, that's my fear around it. But I can't stay in this. I can't stay in this not knowing what's happening or who I am anymore because I'm not the same Missy without Colette, like, not at all. And I'm afraid to figure out who I am going to be without her. And so what that's done is pushed me back into borderline identity crisis because I'm not the same Missy anymore. Um, so I really, really was hoping to jump on here and find some people that knew a lot about this. And I knew it would be a long shot on YouTube because I just started YouTube. Hopefully it will let me post this on my TikTok because I have a really big following on there. And I have a really great group of people, a really great group of people who would not hesitate to jump on and talk to me about this. Um, I'm still trying to invite people. Okay, so I'm going to pause this for just a second to bear with me. Okay, so I shared it to my Facebook and my YouTube, so hopefully some people will jump on, but if not, it will be on here. So symptoms. During the first few months after a loss, many signs and symptoms of normal grief are the same of those as complicated grief. However, while normal grief symptoms gradually start to fade over time, those of complicated grief linger or get worse. And I feel like mine's getting worse. That's a little bit hard to say because I'm having a good day today, but on the days where I'm not, it's like my head starts filling with all these thoughts and questions and anger. And I've found myself angry at my daughter for leaving because what she left behind was nothing that I have control over. She was married, her baby daddy is around, and I don't have control over seeing my granddaughter, who I used to see all the time. She just turned 6, and I don't have control over getting any of my daughter's things at all because she was married. And they're all locked up in a storage unit somewhere that I don't even know where it's at. So, signs and symptoms of complicated grief may include intense sorrow, pain, and rumination over the loss of your loved one, focus on little else but your loved one's death, extreme focus on reminders of the loved one, or excessive avoidance of reminders. And I go back and forth. I'll put all of her things away that I do have, like her pictures and stuff that I have. I'll put them away and then I'll turn them back around. Put them away, turn them back around. Intense and persistent longing or pining for the deceased. And I do that. You know, she was my best friend. She would still come over and crawl in bed with me and watch Adventure Time, you know, at age 27. And so it's a big one. You know, I spent 27 years with her, and I was a kid when I had her. You know, it was us two kids taking on the world together, and now I'm here and she's not. And so problems accepting the death, numbness or detachment, bitterness about your loss, feeling that life holds no meaning or purpose, lack of trust in others, inability to enjoy life or think back on positive experiences with your loved one. You may have trouble carrying out normal routines. You may isolate from others and withdraw from social activities. Experience depression. And I've said this so many times this year. I feel like I'm depressed, like I've never been depressed. I've been fucking depressed. And it is a first for me. Deep sadness, guilt, or self-blame. Believe that you did something wrong or could have prevented the death. Feel life isn't worth living without your loved one, and wishing you had died along with your loved one. When to see a doctor. Contact your doctor or mental health professional if you have intense grief and problems functioning that don't improve at least 1 year after the passing of your loved one. So that's going to be January 18th. And, you know, Christmas is coming. I have a 7-year-old. I have grandkids. I have my 6-year-old. And I don't want to feel like this. You know, I couldn't do Thanksgiving. I did. I went and I sat in the corner and cried, got in a fight with my family on purpose, you know, pushing away, isolating. And keep in mind, I did not know what happened until maybe 2 months ago. I knew that she had fentanyl poisoning, but I didn't know how it all went down or what happened. And I was told all the details without wanting to be. And so now I also have a vision in my head of what happened that I didn't need to have. And it's fucking heartbreaking. You know, it's heartbreaking. So I'm clearly not going to bring people on tonight. I just don't have a big enough following on here, but that's fine. I'm going to keep at it because this is me reaching out for help. And for whatever reason, TikTok isn't letting me do that with my big following. It says, it's not known what causes complicated grief. As with many mental health disorders, it may involve your environment, your personality, inherited traits, and your body's natural chemical makeup. So it has, you know, I have gotten through my borderline, and I've learned how to maintain my borderline, I should say, but this has brought my borderline back. And so depression, borderline, all the things, they're just front and center. And feeling like I can't do anything right, you know, feeling like my other kids feel like they're not worth my time because I'm sad about my other one. It's just such a fucking mess. And it says risk factors for complicated grief. They're more often in females. An unexpected or violent death, such as a car accident or the murder or suicide of a loved one. Death of a child. So death of 3 children for me at this point. And that's my fear of not coming out of it. Close or dependent relationship to this deceased person. We were very codependent. and very close. Social isolation or loss of support system or friendships. And see, now I do that. I will push people that are closest to me away because I'm afraid they're going to fucking die, truthfully. Um, Past history of depression, separation anxiety, or post traumatic stress disorder, which I have separation, I guess post traumatic stress disorder is the one that comes out. Traumatic childhood experiences, yes. And other major life stressors, yes. Complicated grief can affect you physically, mentally, and socially. Without appropriate treatments, complications may include depression, suicidal thoughts or behaviors, anxiety, including PTSD, significant sleep disturbances. And that's one thing. Another thing, along with depression, I have had insomnia off and on throughout this whole year. I've never experienced that. I've had night terrors, I've had sleep paralysis, I've had it, you name it, I've had it. But I've never had insomnia and I've never had depression, and I have both. I'm either up all night or sleep all night and all day. Like I can't get into a normal pattern. Um, Increased risk of physical illness such as heart disease, cancer, or high blood pressure, long-term difficulty with daily living, relationships, or work activities, alcohol, nicotine use, or substance misuse. So I'm not a drinker, I'm not a user, but I'm smoking like a chimney. So prevention, this is the fun sentence. It's not clear how to prevent complicated grief. Getting counseling soon after a loss may help, especially for people at increased risk of developing complicated grief. In addition, care providers providing end-of-life care, blah, 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 blah. Talking about your grief and allowing yourself to cry can also help you. See, that's another thing I get stuck on because I feel like that's all I fucking do. And people are getting sick of it. Like I'm not getting grace as the mother, it's like the husband and the baby's daddy and the people, it's like they're put out with me. And it's like, it hurts. It's like lose 3 children and then come talk to me, because I'm not trying to relive this. I'm not trying to talk about it. I'm trying to figure out how the fuck I'm going to live my life without her. And I know I'm going to live it. I just don't know who I'm going to be. I don't want to be bitter. I don't want to be anything other than who I know myself to be, which is a helper. And I don't want that taken away. I have a very small handful of people that give me enough grace to put up with me. I have a big handful of people who get really frustrated with me. And that's really hard because it adds shame and guilt to this, which I just can't fucking help. Like I miss her and I miss my other ones, and I'm afraid about my other ones, and I'm not trying to put that out in the universe. It's just the truth. I'm afraid. And I don't know who wouldn't be, you know? And there's some generational trauma going on here that I'm trying to figure out how to end, because it started generations ago. My dad's sister died. My dad's grandpa shot himself in the head, and my dad watched when he was a kid, he he had to go to his cousin's 16th surprise birthday party and tell everyone his cousin was dead because he died in the woods with him that day. There's stuff on my mom's side. My aunt lost both of her children and her husband. My sister lost her husband. My other sister lost her baby daddy a month before she had their baby. It doesn't end. It doesn't end in our family, and like I said, for generations. So I have a really good friend looking up like generational trauma, generational curses, whatever this is. It feels intense, and I know that people lose people, but to have, my aunt just lives up the street, and we both lost she lost her entire family. I've lost more than I've kept, And it's just not common. I don't think it's that common to have that much loss in a household, in a family. Um, like I said, my sister was 9 months pregnant when who she was going to marry, was killed in a car accident coming to see her. My other sister was with her life partner for 10 years, so in love, so happy, and bam, stroke, dead just a couple years ago. Me, it's been my children. And so this, like I said, I didn't really expect people to be on here. I hope that I can build it up to where people are, because I really could use some help and some advice. Um, so I'm gonna see if, just keeping this on here and maybe reposting it will get me some people that notice this, because I am literally reaching out as a mother, as a grandmother, just as me, looking for some advice. The holidays are like killing me, and they happen to be right when her 1 year death date is. And I need to be moving forward, and I'm woke. I believe in reincarnation. I believe in all of the things. And that used to give me comfort. And now it scares me because, yeah, I'm sure I'll see her again, but it won't be as my daughter, and that's one thing that stays and constantly goes around. Everybody told me when my baby died, when Poppy died, you'll see her again, you'll see her again. Not as my daughter, not as this. This is over. And that's what kills me. This is what's over, is me being Missy and having Ozzy, Poppy, and Colette, and Holly and Jill. Now I have Holly and Jill. So even in my awakening, it's complicated and difficult. Andrew Huberman has helped me probably more than anybody, just by opening my eyes to what the fuck is going on. Now I need help getting out. And the place, I know there's online therapists and stuff, and I may try that, but where I live, all the medical is ran by one place, and it's not a place I would send my own kid. So I don't feel they'll be very helpful to me. The first few weren't. So I'm going to get off here, and I'm going to repost on Facebook. And if you see this on my channel and happen to know anyone that works in this field or does the EMDR, whatever therapy, the erotic eye movement, or just knows about this or lived it, please guide them to my channel, because I really want to do a live and have like a discussion before Christmas. Like, I want to give my girls and my grandkids such a good Christmas, and I don't want to be sitting there crying. I don't want to be sitting there crying. I want to be sitting there laughing and smiling with them. And at this point, it doesn't seem possible. So yeah, I'm going to get off here, and I appreciate you guys listening, and I'll post this in a couple different things on my YouTube, and then I will try to post it on TikTok. It may be too long, I don't know. But I'm going to call my friend who offered to have me come and do her cell regeneration. She has a setup at her house, and it's all legit. It's amazing, and I'm going to go try that. I'll let you guys know how that turns out. I'm going to be calling her tomorrow. But I hope somebody sees this. I hope somebody sees this and cares, because I don't reach out very often for help. So it would mean a lot to me. And I hope you guys all have a really good night. And I'm going to try to do the same. So thank you again.